Hi everyone, my name is Angela Meadows. I am a second year student at the Baker College of Dental Hygiene. The purpose of this video is to discuss the do's and don'ts of using a mouth rinse. So the first thing we're going to go over are the don'ts. Don't swallow the mouth rinse, that is the biggest thing. The second don't is when you put the mouth rinse in your mouth, don't go back and forth, trying to swish it around without using your cheeks. As silly as it may sound, there are a lot of people, a lot of patients who come in and they say they're just waiting for their 30-second timer to go off. So maybe they're being silly, or maybe they just don't feel like swishing it with their cheeks. Maybe their cheeks are sore from laughing or smiling all day. I mean, whatever the case may be, you're not really getting it between those teeth. You're not really forcing the product in between those teeth, where a lot of times that's where it's needed most. Another common thing I hear is that when patients use a mouth rinse, they just let it sit in there while they're waiting for the timer to go off. So they're not really doing any of that vigorous action. It's just sitting, on the back teeth. So the front teeth or the face side of those teeth might not be getting any of the product while the back teeth are getting it all. So those are the three don'ts. Now let's go over some of the do's. When you use a mouth rinse, make sure to look at the manufacturer's directions because every mouth rinse is a little bit different. But as a generalized rule, most will recommend that you use them for about 30 seconds. The amounts for each mouth rinse, they do vary. So it would be recommended to keep a little plastic measuring spoon in your bathroom, because I know for Listerine, it's 4 teaspoons or 20 milliliters, so 2/3 of a fluid ounce. Other mouth rinses may not require that much or may require a little bit more. So just look at the directions so you get a baseline of how much you need to use, because you don't want to use too much, but you don't want to use too little. The next thing is when you're actually rinsing with it, try to force the product through your teeth as if you're pushing it to the other side. So if it's on the tongue side, you're trying to push it to the face side. You really want that product to get interproximal or in between the teeth where it's usually needed the most. And also you want to rinse for about 30 seconds. So a lot of times people will put a timer on their phone, or maybe they have a watch you can use, or you can watch a short video or watch a commercial or something of that nature. But as long as you're timing yourself for about 30 seconds, or specifically whatever the product recommends, that way you're getting as much benefit as you can from that product. And lastly, if you use a fluoridated mouth rinse, it is recommended that you usually wait about 30 minutes after using that mouth rinse, just so that fluoride can really sit on the tooth or really soak into those teeth to try to give them as much protection from cavities as it can. Try to keep that surface as strong as it can. So if you use a fluoridated mouth rinse, sometimes it's easier to use it at night, so that way you don't really have to think about that 30 minutes of waiting to eat or drink, because you're just going to bed anyway. So that's all I have for how to use mouth rinses.